to our stakeholder meeting to introduce our telehealth project proposal regarding the need for a video interpretation system at San Juan Regional Medical Center. The agenda for this meeting is to introduce the needs assessment utilized to identify a current gap in patient care, propose a telehealth application that will address the gap, identify key stakeholders for our project, delineate project roles, describe enhanced outcomes that we hope to achieve, discuss opportunities for improved organizational effectiveness, identify an outcome measure to ensure meaningful use, discuss considerations for confidentiality and privacy, and develop the project implementation steps and timeline. According to the 2023 Community Health Needs Assessment, 30.6% of San Juan County residents reported consistent access to a continuing source of care, compared to the national rate of 69.9% and the 84% Healthy People 2030 benchmark. This lack of access represents a significant disparity. The population is comprised of a significant number of Native Americans who represent 40% of the population according to data from the U.S. Census Bureau. Many of these patients travel to Farmington, New Mexico to receive care from specialists and have reported difficulty in communicating with their care team due to linguistic isolation, language discordance, and a lack of reliable interpretation services. Language discordance and barriers to access have been shown to negatively affect health literacy and patient outcomes. As a facility that serves minority, low-income, and low English proficiency safety net patients, San Juan Regional Medical Center would benefit from the integration of video interpretation technology as a critical component of the organization's telehealth infrastructure. Digital access to telehealth specialists in conjunction with video interpretation would significantly improve safe and efficient patient access to providers. In addition to facilitating telehealth visits, the video interpretation system represents a best practice for healthcare institutions regarding the provision of culturally relevant and ethical care. It not only supports the quadruple aim regarding the patient experience, but facilitates reciprocal communication regarding medical concepts. This maximizes value and relevance for all stakeholders. Prior to the availability of video interpretation services were limited by a lack of access to trained medical interpreters and limitations on spoken languages. The application of this technology significantly improves that access. Key stakeholders involved in this process would be organizational leaders, the information technology or IT department, the hospital compliance officer, physicians, patients, and the healthcare team. Considering the demographics and linguistic isolation of the patient population, it can be assumed that the application of video interpretation for in-person and telehealth visits is imperative. The role of the Navajo tribal government in supporting the use of interpretation services is unknown. A partnership with local tribal leaders may facilitate the adoption of this technology by community members and should be considered. To ensure the success of the project, it will be imperative to identify an executive sponsor among organizational leadership and a physician champion among physician stakeholders. The executive sponsor will facilitate the financial aspects and validate organizational alignment of the project, while the physician champion will establish buy-in from their peers. It will also be important to identify change agents among the interdisciplinary healthcare team to help foster successful change. The role of the healthcare team is to assist in scheduling visits, accessing the video interpretation system, and preparing patients by addressing expectations. The development of a standardized workflow process may also facilitate the scheduling of patients. Physicians can also promote the use of video interpretation by requesting the consult and using it when they identify a patient with a potential language barrier. In this way, the team promotes organizational change, equity, and autonomy. Important outcomes and vision for the integration of this technology include timely and efficient appointments, improved health literacy and engagement, promotion of equity and autonomy, and compliance with regulatory requirements regarding informed decision-making. Providing medical interpretation services as a best practice mitigates negative outcomes by improving health literacy, obtaining first-hand information for accurate diagnoses, and facilitating reciprocal communication regarding treatment plans and additional testing. Language discordance impairs organizational effectiveness by contributing to diminished health literacy, inaccurate or misdiagnoses, a lack of follow-up, medication complications, poor compliance, repeated testing, and prolonged hospitalization. Clear, interpreted communication provides an opportunity to ask questions and obtain clarity to achieve understanding. This supports equitable patient-centered care by enabling the patient to accurately communicate needs and function as a healthcare team member, aiding in the development of culturally relevant healthcare. This communication also promotes effectiveness by decreasing the workload and frustration caused by inaccurate or incomplete healthcare information for healthcare workers. A patient and staff survey should be obtained after use to measure effectiveness. Criteria and questions should center around the opportunities for effectiveness listed on this slide. According to the Joint Commission and the Centers for Medicare and Medicaid Services guidelines, there is not a one-size-fits-all solution to address language discordance. Rather, organizations should actively pursue solutions to support limited English proficiency patient populations and create programs tailored to their unique community needs. While there is strong evidence, backed by regulating and accrediting bodies, supporting the need for translation services, a clear-cut outcome goal is lacking. To ensure meaningful use of the video interpretation systems, organizations must establish policies that outline technology use and should establish outcome measures by which to measure effectiveness. With these regulations and guidelines in mind, an effective outcome measure for San Juan Regional Medical Center is to utilize the video interpretation system for greater than 99% of patients in which language discordance has been identified and in which the patient consents to its use. When integrating telehealth applications, it is important to consider the existing IT infrastructure to ensure adequate digital security and protect against confidentiality breaches. This helps to meet regulatory requirements as well as fostering ethical and safe engagement. Regarding remote access, the role of the healthcare institution or provider in verifying a secure connection on the patient side is unknown. Physical security of video interpretation devices should be considered, and anti-theft measures such as AirTags, alarm systems, and perimeters should be installed. Regulation of interpretation services within the organization is necessary to ensure appropriate use and compliance with the Health Insurance Portability and Accountability Act security rule. Organizations must ensure that the service being used is accredited for the interpretation and protection of healthcare data. After internet, physical security, and confidentiality have been confirmed, it is important that the healthcare providers apply the same privacy protections for an in-person visit to a telehealth visit. Patients should be coached and encouraged to conduct their visit in a private, quiet place if remote, and should treat any information given or received as private health information. The level of liability for the provider in conducting telehealth visits with a patient on a personal portable device, such as a smartphone, is unknown and would add significantly to this discussion. Within healthcare institutions, digital applications must be utilized in such a way that interpretation cards can be transported easily to exam or procedural rooms. The use of kiosks in public or open spaces does not permit and protect the exchange of private information. In this way, the confidentiality of data is supported and protected. The first step of this proposed project is currently underway. Identifying key stakeholders for the interdisciplinary team and engaging them in the shared vision and outcomes for this project is a critical first step. If approved, the next step would be to select an implementation framework. The REACH, Effectiveness, Adoption, Implementation, and Maintenance, or RE-AIM framework, has been successfully utilized for rapid implementation of telehealth technologies during the recent pandemic. It can be assumed, based on historical use and success, that this framework could facilitate implementation within the next 6 to 8 months. An accredited telehealth service and delivery mode will be identified and validated by team members in IT and compliance. After costs, funding, and adequate infrastructure have been established, policies for meaningful use will be established and education will start. In order to promote effective implementation by internal and external stakeholders, digital literacy must be addressed and facilitated. A survey regarding readiness for change and attitudes technology can be administered to identify and address barriers early. At this time, I would like to answer any questions that you may have regarding this project. Thank you so much for your time and participation today.